Hello everyone, this is Dr. Prajakta Patil. Today is 25th April is actually the World Malaria Day. Everyone knows what malaria is. But how does it cause exactly? How many days after you get bitten by the mosquito do you actually get the disease? I'm just going to brief on what happens to the parasite when it is inside the mosquito and what happens when it comes in our body and how we get the disease. Also the signs and symptoms which we get so that we can diagnose if someone has malaria. Also the diagnosis, the treatment, any specific indications for pregnancy and in children below than 5 years. So how does malaria affect such patients? Obviously the preventive measures also. So in today's era of COVID, malaria still holds a very important place because still we have not been able to eliminate this disease. We have been hearing about malaria since ages, but still this disease is not eliminated. The goal is actually to eliminate malaria by 2030. So if by 2027 we can eliminate malaria, then within 3 years if the malarial spike doesn't occur, then we can declare that we have eliminated malaria. So this is our goal. Also there is guidelines for us doctors also or laboratories to report each and every case of malaria to the BMC. This guideline was not there before, which has come into force this week itself. So this is something the government is also trying because we are thinking about the rainy season in the future. This is the time when maximum cases of malaria come up. So first let's see how is malaria transmitted. The main causative organism for malaria is actually a plasmodium. It is a type of microorganism which is a parasite. This parasite is actually transmitted with the help of mosquito into our body. The mosquito itself doesn't cause any disease for us, but the plasmodium or the microorganism which we get after the mosquito bites us, that causes the malaria. This plasmodium is actually of 5 types, and depending upon which type of this microorganism is infected to us, the treatment also varies, also the symptoms vary, also at times the severity also varies. So first, how we get the disease. For example, there is one person, like for example, I am having malaria and a mosquito bites me. So the mosquito will actually take the blood feed from me and in turn the plasmodium, because I am infected from malaria. I have the plasmodium or the microorganism in my body. So this microorganism will go into the mosquito. Now this microorganism will complete a cycle of total almost 15 days inside the mosquito. When the mosquito bites, at that time this microorganism is actually in the form of gametocytes. These gametocytes have the reproductive capacity. They can reproduce and produce more of this plasmodium. Initially it gets attached to the stomach wall of the mosquito, and from there it has a cycle where it goes into the salivary glands of the mosquito. So this cycle for the plasmodium to actually spread from the gametophyte phase to the stomach wall to the salivary gland of the mosquito, actually it takes almost 15 days. So after this period of time, when the mosquito is biting another person who is very healthy and doesn't have this malarial disease, the mosquito bites this person. So when the mosquito is actually having the blood feed, so this plasmodium will actually get injected into the person's body. It is the liver which is involved and the blood which is involved when we are talking about malaria. In the blood circulation, these organisms actually stay inside the RBC, or they infect the RBC, that is the red blood corpuscles or the red blood cells. These all will come into the bloodstream. So when this occurs, the patient mostly gets fever, chills, fatigue, other symptoms like headache, malaise, everything. So this is the time when the person comes to know something is wrong with me. Till that time there are no symptoms at all, but the parasite has already come into the blood circulation. So like this, the patient gets periodically the patient will get fever spikes within some hours, some get within 4 hours, some get within 8 hours, and again the patient will get fever. Initially comes with chills. The patient has to take 2-3 blankets and still the patient is shivery. That is a typical symptom. So in the blood test, we take the blood for peripheral smear of malaria. That is, in the blood we see whether the malarial parasite we can see. That is one test which is confirmatory. If you want to do further evaluation, we can also see which strain of malaria do we have. If we have falciparum malaria, vivax malaria. So these are the different types of malaria. If we are having vivax malaria, then after you get cured the malarial infection, there has to be one drug which has to be given for 14 days so that we don't get this infection again. If that is not done, then again within a period of 6 months to 1 year you can get recurrent malaria. Also in malaria, because I talked about RBCs, correct? So we always see that there is some kind of, especially the fever has lasted for a significant period of time, there is also less of hemoglobin, also there is less of platelets which we see in the patients. Regarding pregnant women are 10 times likely to get malaria because yes, the immunity is less. Therefore, we always advise whenever we are dealing with a pregnant woman, the environment around her, it should be very clean. She should be shifted to a better environment if the place is not clean, or if there is a dumping ground around, something like that. In pregnancy, it becomes tricky because there are some malarial medicines which are not advised to be taken in pregnancy, and at times we have to weigh the risk whether the medicine's effect would be more than the side effects. There are definitely some medicines which can be given safely in pregnancy, but always when there is malaria in pregnancy, we have to be a little bit cautious because whenever the patient is getting fever, especially because of the medicines, the patient is not able to eat correctly, and also because of the fever, so we don't want any growth restrictions for the baby. Also, if the patient is borderline anemic initially, it can also cause anemia for the patient. We don't want thrombocytopenia, that is less of platelets. Not every time, but sometimes yes, we do have to admit such patients in the hospital and treat them, especially if they require IV injections. So that is one thing which we do. In children less than 5 years, yes, malaria is little bit complicated because we have seen that because of the high fever, children even do get convulsions. In children, cerebral means the malaria which affects the brain, it can progress quite rapidly because of low immunity, and it can become a severe disease. So yes, in children, obviously we have to treat nicely. For this, we advise that children should not go too much towards the dumping grounds, the litter areas, the garden which is not cleaned. So this is something which we definitely have to keep in mind. Regarding the preventive measures, I talked briefly that insecticides are used by the government. We can do to segregate dry and wet waste. Always keep your surroundings clean. Always see to it that if you are living in certain society or a complex anywhere, that the place where the garbage is actually there, it is not just an open bin which is a dumping ground. Closed bin is something which we advise so that litter is not there. Also, see if regular cleaning, if someone is coming to collect the litter, if it is not, then please notify that the litter is not being cleared. So this is one thing. Also, we know that these are the mosquitoes which bite from the dusk to dawn, that is from the evening till the morning. So obviously when we are staying indoors, when we are after evening time and at the night time, always make sure that the windows are closed. Always make sure that you are using some mosquito repellents. You can use any liquid form, you can use mosquito agarbattis also, you can use bat. So all these things is something which you can use. Malaria is not caused by all mosquitoes. This is also there. Only the female Anopheles mosquito is the one which causes malaria. But when we are actually in the sleep, we can't recognize which one is female Anopheles mosquito. So yes, it is always recommended so that there should not be too much mosquitoes because we never know. So this is all I wanted to say for today, and stay blessed, stay malaria free, raise the awareness regarding this disease, and always be healthy.